Medicaid, more tax credits to help buy insurance, and a tax slash, they say, for the wealthy. It's what's packed in the Senate's plan to replace Obamacare, which could be voted on next week.
And if it passes and becomes the new law of the land, how will the Senate's Health Care Act impact California? CBS 2's Randy Paige is live at UCLA, where he tracked down some answers for us. And Randy, according to some people, the news looks grim.
That's exactly right, Pat. To begin with, California, compared to other states, is really in pretty good shape. Plenty of insurers in the marketplace, quite a few options for consumers, and a lot of young, healthy people who've chosen to get health insurance. So we wanted to know, how could this plan in Washington impact us here in California? And we put that question to one of the state's leading experts in healthcare policy, beginning with this question. If you were to grade the bill proposed in Washington today, what would that grade be?
It's an F-. There's nothing in here that's good for the American people.
Professor Gerald Kaminsky, the director of the UCLA Center for Health Policy Research, says under the proposed Republican health care plan, fewer people in California would be covered. Costs would go up substantially for older people, and there would be dramatic cuts in federal support for the working poor.
It's unconscionable.
Professor Kaminsky says more young and healthy people in California would choose not to have health insurance, since there would be no penalties if they choose to opt out under the proposed health care bill. And that leaves sicker people on the insurance rolls, which would drive up the cost of premiums.
Consumers beware. If you buy insurance through Covered California, it's going to be more expensive. And if you are on the Medi-Cal program, the future looks bleak.
It is really the working poor who will be most harmed.
Carmen Balber is executive director of Consumer Watchdog, a nonpartisan nonprofit in Santa Monica that keeps an eye on the healthcare industry in California.
The cut to Medicaid alone will be devastating in California. Millions of people will lose coverage and will lose millions and millions and millions of dollars in funding that we currently put towards healthcare.
So where do we go from here? Well, Professor Kaminsky says, first of all, he would like to see either the House or the Senate version simply not pass. Then he says it would be a great idea if Republicans and Democrats in Washington could come together to try to fix the problem with the Affordable Care Act, try to do what's best for health care in this country. Then you can call it whatever you want, but somehow reach a compromise. And experts here, as well as in Washington, say that's probably not going to happen anytime soon. Pat, Jeff?